This guide explains how to treat fever in adults with safe home steps, what causes fever, and the red flags you should not ignore. You'll learn what helps, what hurts, and how to feel better sooner. Understanding. What causes fever in adults? Fever is a defense move. Your immune system raises your core temperature to make it harder for germs to grow. That heat can come with chills, fatigue, headache, and body aches. Common causes include viral infections like flu or COVID, bacterial illnesses such as strep throat or a UTI, and heat exhaustion. Most fevers are not serious, but they signal something is going on. Accurate readings guide smart choices. Use a digital thermometer. For oral readings, avoid hot or cold drinks for 15 minutes first. Sit still, then measure. Ear and forehead thermometers are helpful, but follow the device's directions. Track your numbers, time of day, and symptoms to see patterns. Common triggers and early signs: flu or common cold, urinary tract infections, stomach bugs, sinus infections, certain medicines or vaccines, overheating after workouts or outdoor heat. Early signs: headache, muscle aches, chills, sweating, tiredness, mild nausea. Adults often push through mild symptoms. Better choice: monitor, rest, and note your temperature trend. A brief rise after hard exercise usually settles with cooling and fluids, while illness-related fever lingers or climbs. Why adults handle fever differently. Adults usually manage short fevers well because their immune systems are more mature. Still, chronic conditions like diabetes, heart or lung disease, and immune disorders raise risk. Fevers over 103 degrees Celsius need faster attention. Adults over 65 can get sicker with lower fevers, so watch for confusion, weakness, or dehydration. Short fevers often pass with rest and fluids. Safe ways to treat fever at home. Focus on comfort, fluids, and rest. These steps support your body while it works. Hydrate well. Sip water, oral rehydration solutions, or broths. Aim for pale yellow urine, light clothing, and a cool room. Keep the room around 68 to 72 degrees. Use a light blanket if you feel chilled. Skip alcohol rubs and ice baths. They can cause shivering, which raises internal heat. Try a lukewarm shower instead. Rest. Sleep boosts immune function. Keep screens low and tasks simple. Smart symptom care. Pain relievers can lower fever and ease aches. If you ask how to treat fever in adults with simple tools, start with fluids, rest, and correct dosing of over-the-counter meds when needed. Medications that help lower temperature: acetaminophen, Tylenol, 325 to 1,500 mg every 4 to 6 hours as needed, max 3,000 mg per day unless your doctor says otherwise. Ibuprofen, Advil, Motrin, 200 to 400 mg every 6 to 8 hours as needed, max 1,200 mg per day over the counter. Tips that keep you safe. Check labels so you do not double dose acetaminophen in combo cold meds. Ask a pharmacist if you take blood thinners, have liver or kidney disease, or use other medicines. Avoid aspirin if you have bleeding risks or stomach ulcers. Skip meds if your fever is low and you feel okay. Fever can help fight infection. These medicines work by acting on your brain's temperature center, easing fever and pain. Lifestyle tips for quick relief. Cool compresses, place on your forehead, neck, or wrists for short bursts. Light foods, soups, yogurt, toast, fruit. Eat small, frequent meals. Gentle routine. Wake, hydrate, take meds if needed. Light snack, nap, brief stretch, more fluids. Early bedtime. Avoid strenuous activity. Save workouts until 24 hours fever-free. Herbal teas. Ginger or chamomile can soothe, but use them as comfort, not treatment. Prioritize sleep. Aim for longer, quality rest while sick. When to get professional medical help. Call a doctor if fever lasts over 3 days, tops 103 degrees Celsius, or comes with severe symptoms like chest pain, confusion, stiff neck, bad headache, or a spreading rash. Go to urgent care or the ER for trouble breathing, signs of dehydration, very dark urine, dizziness, no urination for 8 hours, persistent vomiting, or severe weakness. This article offers general guidance, not medical advice. Contact your local clinic, urgent care, or telehealth for personal care. Warning signs. You shouldn't ignore high fever with heart disease, lung disease, kidney disease, or diabetes. Fever during pregnancy, seizure, fainting, or new confusion. Severe chest pain or shortness of breath. Persistent vomiting or diarrhea. Fever that returns after it went down, stiff neck with headache, or a purple or blotchy rash. Conclusion: most adult fevers fade with rest, fluids, and simple care. You now know how to treat fever in adults at home and the signs that need quick help. Keep a thermometer handy, stay hydrated, and consider flu and COVID vaccines to cut risk. If you're unsure, call a healthcare professional. Share your experience or questions in the comments and take good care of yourself today.